আসসালামু আলাইকুম ম্যাডাম।
Hello.
আসসালামু
Hello.
আলাইকুম ম্যাডাম।
Walaikum assalam. How are you?
I'm fine, madam. And you?
Good, I'm fine. So, can you hear me?
Yes, ma'am.
Okay. So, how are you, Russell?
Yes, ma'am.
How are you?
Fine, madam.
Good. So, now
doing
you're
well.
feeling better?
Yeah,
So,
madam. Thank you so much.
oh, no, I'm asking, today you are feeling better? Are you feeling better?
Audio
Hello?
problem, madam. Audio problem, maybe. I can't hear you properly.
Now you can hear me? Hello, can you
Yeah,
hear
madam.
me? Now you can hear me?
I'm much better.
Okay, good.
Yeah, madam. Can you
Okay.
hear me?
Yeah, I can hear you.
Yeah, madam. I can hear you.
Okay, tell me.
Yes, madam. I can hear you. Yeah, madam.
Okay. So, should we start the class? Okay, just tell me in the previous lecture. So, all of you can understand clearly?
Sure, madam.
Or any problem?
I'm all understand, ma'am.
Sorry?
I think no, madam. No, madam.
Wait, I will
There
join
are
it.
no problems.
I will join again. Okay, I will join again. Okay, I will join again.
ভাই ওই ম্যাডামের মনে হয় নেটওয়ার্ক সমস্যা হচ্ছে, ম্যাডাম আবার জয়েন করতেছে, দাঁড়ান।
জি ভাই,
হ্যাঁ,
বুঝতে পারছি।
রাসেল
Okay,
ভাইয়ের
okay,
মনে
no
হয়
problem.
রাসেল ভাইয়ের মনে হয় কথা রিপিট হচ্ছে, বুঝছেন? মানে আপনি মনে হয় আমরা বলার কিছুক্ষণ পরে শুনতে পাচ্ছেন।
না, আমি সাথে শুনতে পাচ্ছি।
রাসেল, তোমার
আমি
নেটে
সাথে
সমস্যা আছে।
শুনতে পাচ্ছি, শাহিদ ভাই।
রাসেল, তোমার নেটে সমস্যা আছে। আমি সব একদম ভালোভাবে শুনতে পাচ্ছি।
আচ্ছা, আমি রিকানেক্ট করছি।
হ্যাঁ, রিকানেক্ট করেন, রিকানেক্ট করেন।
আমিও তো শুনতে পাচ্ছি।
না, আপনি পরে শুনছেন।
আচ্ছা,
আমরা বলার
রিকানেক্ট
পরে
করছি,
পরে
সমস্যা
শুনতেছেন।
নেই। আচ্ছা, ঠিক আছে।
ওকে।
Hello?
Hello, ma'am.
Yeah, now you can hear me clearly?
Yes, ma'am, clearly, ma'am.
Okay. अच्छा ये Russell, are you there?
Yeah, madam.
Okay. Okay, I was asking that in the previous classes, okay, we have studies like about the heart and their structure. Okay, so do you have I'm asking from both of you, so do you have any problem in the previous lectures, like since
No, ma'am.
first class to till the last class?
No, madam.
Are you sure?
Yeah, madam.
Yes, ma'am.
Okay, so all concepts are clear?
Yeah, madam.
Yes, ma'am.
Okay.
Ma'am, if they're clear, you can start the today's topic.
Okay. So, yeah. Yeah. So, all of you are seeing, we are Bismillahirrahmanirrahim. Today we will start the ECG. Okay. This is the electrocardiogram. Okay. Okay, tell me, what is the ECG? What is the ECG?
Full form of ECG is electrocardiogram.
No, I know it's a full form. Like, what's the purpose of ECG? What do you know about ECG? What is ECG? I'm not asking in the detail. Okay? Yeah.
ECG is the graph of the electrical activity of the heart.
Okay.
Is it okay, ma'am?
Let's see. And Mutasir, now you, what is ECG? Okay, no problem.
ECG is the so
No
It's
problem.
okay.
It's okay. No problem. Okay, so today we will study like about the ECG. So first of all, what we will study in this topic. So number like this objectives. Okay, so in this topic we define ECG and list uses of ECG. Okay, that what is the uses of ECG? Explain basic ECG principles. Next is the describe ECG, LEDs and their application. Okay. You know LEDs, what's the LED? It's a wired something which is applied on the chest and on the foot. The wired something LED and attached
yes,
yeah.
ma'am.
So that one is called the
Yes, ma'am.
LED.
Ma'am.
Okay,
Yes.
that one is called the
Yeah.
LED. And it
We are similar.
yeah. So and recognize ECG waves. Okay, obviously the waves is formed is just like this one. Okay, so recognize ECG waves, intervals and segments. Next,
Yeah.
determine rate. It's very noisy from here. Okay. So determine rate and normal heart rhythm. Have some
Madam, are you there? I cannot hear you.
So this device
Madam, are
is
you
the
there?
yeah.
Okay.
Can you hear me?
Yeah. No.
Okay.
It's okay.
Okay. So this device is the ECG machine. Okay. In the old people, like like you can say, so this type of ECG machine was using like And Beethoven's original machine weighted 500 pounds and needed 5 operators. Okay. So this machine has a weight of 500 pounds, this machine, and it needed the 5 operators. Okay. Nowadays we are using the ECG machines, so only one person has like operate. Okay, in the laboratory, in the cath labs, or in any other like memory, like in other lab. So only one person. It's very noisy from your background. Please mute. Yeah, thank you. So only one person can like tackle or can operate. Okay, nowadays, but in the old days, this machine was using. Now next is this is a modern machine. Okay, so this is a modern machine of ECG. Now comes to the ECG is recorded. Yeah, ECG is recorded of the algebraic sum of electrical activity. Okay, it is formed in the electrical activity, like algebraic sum of electrical activity, that is action potential generated by the heart during cardiac cycle. Okay, so which activity we observe? Which type of activity? Like the action potential, means the action is potential, which that action which is generated by the heart during cardiac cycle. Okay, in the previous lecture we have studied the cardiac cycle. So in the cardiac cycle, during by the heart, okay, during the cardiac cycle, by the heart, the potential energy is like generated. Okay, some energy like potential energy, or you can say like potential action. Okay, potential energy and potential action is the same thing. Okay, so this is generated. So this ECG is recorded. Now, monophasic action potential recorded from a microelectrode inserted to the inside of a single fiber. Look at here. This is the heart, okay, and this is the ECG. So this is the ECG, okay, and this is like action potential. Like from here, the SA nodes, arterial muscles, AV nodes. So these forms, look at this is mentioned, okay. So this you can say this diagram is not necessary in the exam, okay. Just learn, just read, or just remember this waves like structure is formed. This is the action potential. So for the measurement or for calculate the this activity which is formed in the through the ECG is like this form. Have you seen this one? Are you seeing this
Yes,
one?
ma'am.
Okay. Any
Yes, ma'am.
problem? Any problem here?
No, ma'am.
Okay. Now next is the ECG principle. So what is the ECG principle? Look, when the depolarization wave is spread through heart, electrical current passes into the surrounding tissues, like body fluids are good conductor and can be recorded from surface electrodes. Okay. So
Okay.
what is the principle? Like when depolarization wave is spread through the heart, means when these waves is spread through the heart, so then through the electrodes, this is the electrodes, okay. So this is the electrodes. So through the electrodes, the current passes into the body fluid. Sorry, current passes through the tissues, okay. So current passes through the tissues. So body fluids and are good conductor. Okay, body fluids are good conductor for pass the current. Okay, and it can be recorded from the surface electrodes. Like look at here, this is the electrodes, okay, and this one is the depolarization wave. This one is the depolarization wave. This is the electrodes, and this one is the also the depolarization wave. So depolarization is traveling from left to right. Okay, this is left and this is side right. Okay, these are the electrodes. What is this? These are the electrodes. Okay, so these depolarization waves is traveling from left side to right side. Okay, now in A, now in B, depolarization complete. Look at here. Yeah. Look at here. This is the positive, 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 positive. Okay, this is the positive. So it comes, it started from the left towards the right side. So almost here is the negative signs and this is one is the positive signs. In A, this is the initial. Okay. So,
Madam, what is the
yes.
depolarization? Please,
Sorry.
what is the depolarization?
Depolarization, when the waves is breaking and like a positive charge particles is moved to the negative and negative charge particles move like it's always they moving from the opposite directions. Okay.
Okay.
Got it?
Well, depolarization means moving opposite direction.
Yeah, you can say, yeah. In this chapter, sorry, in this like in this topic, depolarization is like this one is a positive. Okay, this one is the positive and this one is the negative. So this positive charge is moved towards from the right side.
Negative charge.
Yeah, no negative charge from the right side. Here we can just measure the depolarization wave like left to right. Okay, here also here only mention the positions like right to left or left to right. Okay.
Okay. Okay.
Yeah, it's a not positive to negative. It's a just movement of from right to left. So depolarization completed. Now in the B, look at here. Here is the partially. Okay, so depolarization is traveling from left to right. Then in B, it is completed. Look at here. This one is completed. Okay. So depolarization now continue from the repolarization is traveling from left to right. Okay. Now, sorry. Now, how you can see repolarization? Like this is a positive, this is a negative, and here is the negative charge, and here is the positive charge. Okay. In the D, from left side is a positive and right side in the negative. But in the repolarization, yes.
For my understanding, please. Exactly. Depolarization means negative charge becomes positive charge, and repolarization means positive charge again becomes the negative charge.
Exactly.
Is it right?
Here just only charge, yeah. Because from here, look at it, this is a whole negative, this is a whole negative, and this one is positive. Like always, when you pass the current through the fluid or any positive charge to move toward the negative part. Okay, and negative charge particles always move towards the positive charge particles. Same situation is here. This one, look at here, this is the in A, this is the negative. Okay, here's the waves. Just remember, here is a wave and the electric current is passes. Here we discussed there's an electric current passes into surrounding tissues. Obviously, electric current having a like positive charge particles and negative charge particles on the electrodes, right? Look at this. This is the negative charge particle. This is the meter. Okay. Here is a negative. Here is a positive. Understand? So when you connect the electrode, when you attach the electrode, like this one is the negative. Okay. And this
like
one is
anode and madam, like anode and cathode.
yeah, anode cathode you can say.
It's act like anode and cathode. Is it
Yes.
like that?
Yeah.
Okay.
But for your easy for your easy way for your understand, so I'm like a positive and negative. Okay, you can say electrode and cathode also.
Yeah, yeah, yeah.
Okay. Yeah.
Yeah.
So this is a negative charge. So this is a positive charge. So you just connect the negative charge here, and this one is a positive charge. Okay. When current passes through this, so on the negative charge, so positive charge moves towards the negative. Look at here. This electrode is comes from negative. Look, this is a. Please tell me if you have any problem, then ask me, okay? And please do support. So look at here, this is a negative, this is a positive. Okay, so from this negative cathode, okay, this is a negative, right? And this one is a positive. So against the negative, the positive particles, or you can say positive charge particles, move towards the negative. And at the point of positive and inside the when the current passes, so negative particles move towards the positive. Okay. And this process, look, this situation, the outer situation is like you can say is the electrode and cathode. Okay. Like electrodes. Okay. And this inside the situation, the current passes through this cathode. Okay. Now, next in the B, all are positive particles. Okay. Now, next is the repolarization is traveling. Now, same situation. Repolarization is like traveling from left to right. And repolarization is now here is a completed. Look, here is the positive and this one is a negative. So when current is passes, so at the point of positive, negative charge particles come here. And here the outer side is the like negative. So positive charge particles comes to the negative. Understand?
Yes, ma'am.
Okay. So now here in D, repolarization is completed. Like the outer side is the positive charge and inside is the negative charge. Now you can say there, you can just see here that this depolarization wave is made or is formed is the upper side. Okay. Depolarization wave is formed on the upper side like this one, but it is initially from half, then it becomes the full form. Okay. While in the repolarization, we are talking about here repolarization. So it just like it is formed in like below this line. Okay. Just remember always depolarization is from the upper side and repolarization is formed in the lower side. Okay.
Madam, depolarization is the outer part of the body and repolarization of the inner part of the body.
Yeah.
Yes, ma'am.
Depolarization to repolarization, it takes 0.30 seconds. 0.30 seconds, ma'am. It is 0.30 seconds to complete the circle or
Yes.
depolarization to repolarization.
here is not mentioned, but in the further you will see in detail. Okay. Here is a just a principle. Okay. This one is not in detail. This is the only principle. Okay. But in detail you will see. Yeah. But remember, the repolarization wave is always formed in the negative particle.
Negative.
Oh, yeah. Negative particle, charged particle. While the depolarization is formed always positive. Okay, positive. And how it can get positive? How it can get? When from the electrode, okay, from the electrode, it comes from the negative, then positive charge move toward the negative, and from the positive, then negative charge move towards the positive. Okay.
Okay.
Thank you. Now, next is the okay, and in this topic, after because this is your first semester, so you will not need to learn like in the details, but in the further process, in the further syllabus, you will study in the like in detail. Okay. So now, what types of information can we obtain from an ECG? Okay. Number 1, heart rate. Number 2, heart axis. Number 3, heart rhythm. Myopathies, carditis, chamber hypertrophy, conduction defects, myocardial, ischemia, electrolyte disturbances, and drug toxicity. Okay. So what type of information? These types of information we can obtain from an ECG. When you will do ECG for to any patient, so you can observe, you can obtain these information. Now, comes to the further, like number 1, electric axis. So what is the electric axis? Here is a horizontal, normal, or vertical. Okay. Number 2 is the heart rate. Tachycardia, it's a normal or bradycardia. Okay. So number 4 is the activation sequences disorder like AV conduction, RBBBB and LBBBB. Now 5th is the hypertrophy like atrial ventricular. Okay. Like by the ECG, you can the movement, the everything which is going under the heart, like atrial ventricular, what is the how it's working? It's working slow, it's fast, and what if any you can say if any blockage in the heart, then ECG shows everything. Okay. Now 6th one is the coronary circulation, ischemia injury interact. Okay. Now number 7th is the drug effect.
Ischemia. Madam, it is called ischemia, madam.
Yeah, ischemia.
Yes, ma'am.
Yeah. Number 7th is the digital coordinates. Okay. Mostly people are taking like too much quantity of drugs. Okay. Many people too much in the quantity of drugs. So in this situation, the ECG shows the condition of the heart, means the movement of heart, rate of heartbeat, then means everything can be detected. Okay. If anything is disturbance, like if due to drugs, so after the ECG, doctor just suggested that to reduce the medicines. Okay. If the ECG will be not normal, then doctor should reduce the, because many like especially digital coordinate is the mainly effect on the heart. For your information, like aspirin, you know aspirin, and aspirin
Yeah.
is mostly aspirin is mostly given to the heart patient, to the cardiac patients. Why? It just thin the blood and clot and prevent from the clotting. Okay, so drug effect is more and most important, and it is effect it shows on the ECG. Now it is the electrolyte imbalance. Electrolyte imbalance is the potassium and calcium. If the potassium and calcium is the deficiency in the patient, okay, so through the electrolyte imbalance, calcium is, do you want to ask?
Yes, madam. I have a question from how it exists, madam.
Sorry?
How it exists, madam. ECG. How it exists. Which
Okay.
type of exists? And
Sorry. Can you speak loudly,
who is
please,
the-
Russell?
Ma'am, can you hear me?
Very slow. I can. Your voice is not clearly. Can you speak loudly?
Yeah, ma'am. Sure.
Yeah.
Now, can you hear me, ma'am?
Yeah.
Okay. And which type of exists there in the ECG? And who is the type of disease indicates the
I don't understand.
our
Sometimes your
ECG
voice is very look. Sometimes your voice is very slow. Sometimes it's normal. So please keep your mic to close your mouth. Then I can hear you clearly.
Okay. Okay, ma'am, continue, please.
Okay. No, do you want to ask? Then you can ask, please.
Okay, ma'am. I will ask after the class.
Okay.
Then
Okay, no problem. No problem. So 9th is the cardiac. Okay. So then cardiac, myocarditis and pericarditis, and these types we will study in the further. Okay. This is just, and number 10 is the pacemaker. So this information from this from ECG we can obtain these informations. Okay. Now next is the ECG waveforms. ECG waveforms are 3 waves. Okay, here is a 3 waves. Number 1 is a deflection. In deflection, P wave, QRS complex, and T wave. Look at here. This one is the P wave. Now, when it bends towards down, okay, as you know, have you seen like some ECG? So the wave is come from like this, and then it moves upward. Okay, so the first upward bend the wave. So this is the P. Okay, and then it comes, when it comes in the form of and then move downward, it is called Q. Okay, this is called Q. And when
yeah, madam, first negative deflection is the Q.
Yes.
Yeah, ma'am.
Yeah. So when it comes upward is called R. Okay. I'm not coming in the QRS. I'm only now telling you the separate. This one is Q. When it moves upward, this is called R. And when it comes again downward, like back, return back. Okay. So this is S. Okay. Then it comes again upside and move on in the further. And then again curve. This is called T. Okay. This concept is clear?
Yes, ma'am.
Yes, ma'am.
Are you sure? Okay.
Yeah.
So, okay. So look at here. This is P. Okay, and this is R. Okay. So the distance between P and R, this one is R. Okay. So the distance between P and R is called a PR interval. In the below side. Okay. And the above side, the distance between here, you can look, you can see here, this one. Okay, this one. From P, this line, like this corner, where it is bent. Like it comes like this, this band is come here and at this point. Okay, so from here till this end, this is called the PR segment. Okay, from this point to this point, this is called PR segment.
Madam,
Okay.
start of
Yes.
start of P wave to start of R wave is the PR interval, and
Yes.
end of P wave and start of R wave is PR segment.
Exactly. Good. Thank you so much for your cooperation. Thank you so much. Now I'm getting that you understand this thing. So next is a QT interval. As you know, this one is a Q. Okay, this one is a Q and this is T. So this end and the starting of the Q is the QT interval. Okay, and the same thing is the S, this one S and this one is T. As a PR, just like a PR, this one is the T and this one is the S. So this ST, this is a ST segment. Okay, and the next is the QRS complex. Just wait. उसको आलिया को फोन करके कह दिया, कुमार को फोन करके कह देंगे हम लोग अभी आएंगे थोड़ी देर में. मेरे मोबाइल से कर देंगे, नंबर देंगे. Now next is this is one is the Q and this is the R and this is the S. So this one is the QRS complex. Okay. Now you understand this this graph?
We got it.
Yes, ma'am.
Okay. Now next is उसको call कर दे. Now next is the three segments. Okay, here is a three waves. These are the three waves like P, R, Q, S, T. Okay, like P wave, T wave, Q, R, S complex, and T wave. Okay, Q, R, S. Because these are located or these are situated at the same point. So we conclude the together like QRS. Okay, rather than that on the other side, P is the another wave. P is the another wave. Okay. Now next is a segment. This is the isoelectric record only. Okay, this segment like ST segment, TP segment. What is the TP segment? The distance between from T to P is the TP segment. And next is the PR segments. This segment is the PR. Okay, ST segments, TP segment and PR segment. Okay, so here is the three segments and here is the three waves. Okay, now next is the three intervals, 3 times interval. Include waves like PR interval. Look, PR interval, QT interval and RR interval. Okay. कॉल कर दें, मैसेज नहीं करें, कॉल कर दें. Now next is the ECG waveform. ECG waveform. Just wait, please. Now next is the ECG waveforms. So this is the same diagram. Okay, so due to arterial depolarization, P wave is recorded before onset of arterial systole. Okay, arterial repolarization occurs at the same time with ventricular depolarization. Okay, arterial depolarization occurs at the same time with the ventricular depolarization, but since ventricular depolarization wave is giant, it masks the arterial repolarization wave. Okay, so this P wave is happening in the same, you can say same, in the same situation. Okay, as we studied this diagram. Okay, so this all process is going on here. Okay, and this look, this I will give you the whole like PDF. Okay, for this like whole PDF, but this you can say this diagram is not important. Okay. Now next is the QRS complex. Yes.
Ma'am, when actual depolarization completed, then P wave is recorded. Is it right, madam?
Yeah, right.
Okay.
So QRS complex. QRS complex. So what is QRS complex? Due to ventricular depolarization. Okay, due to ventricular depolarization, Q wave due to depolarization of intraventricular septum. Okay, R wave due to depolarization of ventricles. So this is called why R wave is formed. Why R wave is formed? Because due to the depolarization of ventricles. Okay, and S wave is formed due to the depolarization of base of the heart. This is just give the clues or reasons for the like formation of the waves. Okay, here waveforms, ECG waveforms. Why? Here just giving the reasons like Q wave due to depolarization of interventricular septum, R wave due to the depolarization of ventricle, and S wave due to the depolarization of base of the
Base
heart.
of the heart.
Exactly. Now comes to the QRS. Okay, so QRS complex is recorded before the onset of ventricular systole. Okay. Now comes to the T wave. T wave. So due to ventricular repolarization, okay, when T wave is formed due to ventricular repolarization. You know what is the repolarization? The wave is formed below the base, right? And depolarization is formed above on the positive charge, and repolarization is formed on the negative charge. Understand? So this due to ventricular repolarization. Now T wave is recorded before the onset of ventricular diastole.
That's true.
Yes. Now this diagram is not important. Okay, just look at this. Okay, this is
It's
also we
important
studied.
for learning and for the concept. Yes, it's important for the learning, man. This is
Yeah,
is very important, so we have to learn.
yeah.
Yeah, madam.
But this diagram, as we show in the before, like
Okay.
look here. Okay, so
Yeah.
almost this is the same. We have like this thing now, PR segment, TS, QR, PR interval. So this is the same thing.
But there is a time
Yeah,
duration.
yeah. No,
Time
yeah,
duration is very important in the ECG.
yeah, I know.
Yeah, ma'am.
But just for your information, just for your knowledge, you have not
Yeah,
learned.
ma'am,
You
obviously.
just understand. Yeah, look, something is here in this topic. You don't learn. You don't have to learn. You just memorize in your memory. Just remember. Okay, it's look like just a calculations. Okay, you never know, never learn the mathematics. You just do practice. Okay, so same thing is here. So anyway, now come to the point, PR interval. Okay, what's the PR interval? PR interval is the time from the initial depolarization of arteria to the initial depolarization of ventricle. Okay, what is the PR interval? PR interval is the time from the initial depolarization of arteria to the initial depolarization of ventricle. Now next is the denotes arterial depolarization and AV delay. Okay.
Ma'am,
What
what
is
does
the-
it mean by AV delay?
AV delay,
Atrioventricular delay means what?
exactly. Arterial ventricular delay.
Yeah, ma'am.
Okay.
But
So
what
PR
does
is
it
the,
mean?
but the main, this point is not, but this point is most important. Like what is the PR interval? Is the time from the initial depolarization of arteria to the initial depolarization of ventricle. Okay. Now next is the TP segment. So what is the TP segment? Time interval from end of ventricular repolarization till next arterial depolarization. Okay. Like time interval from end of ventricular repolarization till the next arterial of depolarization. It represents ventricular filling.
Yeah.
Now next is the Q interval. This one. Look at here. This is one. This one. So indicates vent depolarization and repolarization.
Ma'am, what is vent depolarization?
Vent, the ventricular vents comes from the ventricular vent.
Okay.
Okay. Yeah. So here's the ST. This during this segments all ventricular muscles. Okay, here is the vent depolarization, but here is the ventricular muscles. It is a completely depolarized. Okay, here is our completely depolarized. Now next is the RR interval. So the interval between two successive R waves used to measure the heart rate. Okay.
Yeah.
Yeah. When the two successive R waves, where is the R waves? Look at here. Where is the R wave? This one. This one is R and this one is R. So these
The long
both
positive
are
wave.
upsides.
Yes, ma'am.
The upper wave is the
Upside.
R. Yeah, upsides. Okay. The upper wave is the R. Look at this. This one is R. This one is R. So this is the R interval. Okay. And this one is a P. This one is a T. This one is a S. This one is a Q. Okay. Now here is this is the normal. So the time is showing in below. In ECG, The time is showing in below, and the PR interval is the 0.6, and this is the interval. Okay, like below, here's the 0.16 second PR interval. Now, next is the causes of ECG waves. It's too long. Okay. Now, causes of ECG waves. P waves. This is the same thing, but this is just form in the chart form. Okay. Don't worry, I will give you the PDF form. Okay. Maybe tomorrow I will send you the PDF. Okay. Yeah.
Okay, ma'am.
So, yeah. So this is the P wave, QRS complex, and T wave. Now, P wave is the arterial depolarization causes and represent time of electrical impulse from SA node to spread through arterial muscles. Obviously, it is arterial depolarization. So here is the SA node of spread through the arterial muscle. So duration is the 0.08 to 0.1 second. Precedes arterial contraction by 0.01 to 0.02 seconds. This is a contraction and this is a duration. QRS complex is causes, what is the cause? Ventricular depolarization. Okay. We studied before, as do you remember? So this is a ventricular depolarization, and it is measured from beginning of Q wave till end of S wave. Look, beginning of Q and end of S. Sorry, this one. Okay. Yeah. So it consists of three waves. Q wave is a negative wave, R wave is a positive wave, and S wave is a negative. Now, Q wave produced by depolarization of interventricular septum. Okay. It is produced by depolarization of interventricular septum, and R wave is produced by depolarization of ventricular wall. And S wave is produced by depolarization of the base of heart. So the duration is less than 0.1 second, and it precedes ventricular contraction by 0.02 seconds. Occur after P wave by 0.12 to 0.2 seconds is equal to PR interval. Okay. Now next is a T wave. It is also ventricular repolarization, and it occurs during later part of systole, before the onset of diastole. Ventricular repolarization progress from apex to the base of the heart. You know, apex is the upper side, upper corner, and base is the lower corner. So ventricular repolarization progress from apex to the base of the heart, and duration is the 0.27 seconds. Okay.
Okay, ma'am.
Now next is the cardiac vector. Where are Asil?
Yes, madam, I'm here. I'm hearing you, ma'am.
Okay. So cardiac vector. So are you cleared all concepts?
Clear,
ma'am.
ma'am.
Okay. Alamin, concepts clear?
Yeah.
Alameen?
Yes, ma'am.
Clear concept?
Clear concept, ma'am.
Any problem?
No, madam.
Are you sure?
Yes, ma'am.
Okay, thank you. Now come to the, should I move on? Okay. So next is the cardiac vectors. Look at here. This is the heart, okay, and this lead is connected. This is the heart, and here this lead is connected to the heart, okay. So electrical forces can be represented in the form of vectors. A vector is an arrow that point in the direction of the electrical potential generated by the current flow with the arrowhead in the positive direction. Okay, look at this. This is the positive direction. This is the arrow and it moves towards the positive direction. So this is the vector. Look at here. This is the air direction, okay, which is a direction of electrical potential. This is the electrical potential generated by the current flow. When the current is current is passing through the body, then look at this. The current is flow in the positive charge, okay, positive direction. Look at it. This one is a positive and this move from here and then move like this. And here this is moved from this side. Here starting from here, it moves from like this, and from here it moves like this. The length of the arrow is proportional to the voltage of the potential. Now next is the depolarization of the arterial, like P wave. In normal ECG, the arterial T wave appears at about the same time that the QRS complex of the ventricle appears. Therefore, it is almost always totally obscured by the large ventricular QRS complex. Okay, so in normal ECG, the arterial T wave appears about the same time, like when QRS complex is formed in ventricle appear. Okay, when QRS complex of, when QRS complex is formed in ventricle appears. So at the same time, T wave appears. Okay, T waves and QRS waves are appeared at the same time. Next is the vectors that occur at the successive intervals during depolarization. When the cardiac impulse enters the ventricles through the arterioventricular bundle, the first part of the ventricle to become depolarized is the left endocardial surface of the septum. It is spread through the ventricular muscles to the outside of the heart. So this cardiac impulse, when the depolarization is occurring in the ventricle, so it just spread through the ventricular muscles. Okay, ventricular muscle, the outside of the heart. Okay, not inside the heart. It just spread outside the heart. Now, then what will happen? Q wave is caused by initial depolarization of the left side of the septum before the right side. So at the result, the Q wave is formed initially depolarization on the left side before the right side, which creates a weak vector. From the left to right for a fraction of a second. Okay, before the usual base to apex vector occurs. Should I continue or now from the next class? Look at this. This one. This one. This one. This one. This one. This one. Yeah, it's a short. Only
Next
few
class,
minutes. Huh?
Next class.
Next class.
Ma'am, this is
Okay.
very complex. So
Okay, no problem. But I want to say something. I have planned that this topic complete today, but I think it's very complicated, complex. So in the next class, I will continue this thing. But the another topic I will start and I will finish in the next class. Okay.
Okay, ma'am. Okay, ma'am.
So
inshallah, inshallah.
inshallah, please do cooperate in the next class. Okay, I will.
Okay.
I'm leaving this topic here. Okay, I think I know this is very complicated, so I'm leaving here. But in the next class, I will finish this. I will finish this topic, and we'll start the another topic. And another topic is also finished on that class. Okay.
Inshallah.
So what our target in the next class, the next topic, and this one we will have to complete,
Okay, ma'am.
because I will have to complete till 15 December your whole subject.
Okay, ma'am. Okay, ma'am.
Just wait, please. Okay, now inshallah in the next one we will meet. Okay, Allah Hafiz. Allah Hafiz. Walaikum assalam.
Assalamualaikum.
Walaikum assalam.